Welcome to Derm-It Trotter. Don't swear about skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter, Don't Swear About Skincare podcast. We've got another podcast that's going to surely excite you today as we talk a little bit more about atopic dermatitis and some things you probably didn't know about how stress impacts it and, of course, treatment. I've got with me Dr. Matt Zirwas, you know well. He's focused on eczema for the last 20 years of his career, written a textbook, lectured to thousands of dermatologists, over 200 peer-reviewed published articles. So we've got an expert in the house to talk with us about this topic. So welcome to the show, Dr. Zirwas.
Thank you, Dr. Trotter.
So I know one thing that we all complain about in today's world, we're all stressed. We're pulling our hair out, we've overscheduled, overworked, and we all see it impact our health. And a lot of people know, how does this really affect the skin, especially in regards to atopic dermatitis?
Yep. So this is a really interesting question. So let me just say, we don't have fantastic experimental data on this, but we've got more than you would think. So I'm going to be extrapolating a little bit from data looking at skin barrier function in stress. But first, let's go back for a second and talk for a minute about stress. So, right, when we talk about stress from a medical perspective, and I know you know this, but for the listeners, right, really a stress state has primarily is a hormonal and neurological state. So whenever you're under stress, you're releasing more hormones like cortisol, norepinephrine, epinephrine, things like that. And then you also have increased autonomic nerve stimulation. And so the physiologically, right? So the first thing is, whenever we talk about stress affecting atopic derm, it is absolutely nothing like, oh, it's in your head, or you think you feel itchier because you're anxious or something. No, that is not it at all. It is the stress that significantly affects your body physiologically. The analogy that I always give people to really hammer home the idea that this isn't like in your head is, I often talk about Pavlov's dogs, but in the human sense. So I say, look, so think about it like this. When if you're hungry and you smell food that is your favorite food, when your mouth starts to water, that's all in your head, right? Because you smell the food, your brain knows that that's going to relieve your hunger. So it's getting ready to eat and your mouth starts to water. Okay, great. Now that you know that it's in your head, you should be able to fix it, right? So next time you're hungry and you smell something really delicious, just don't let your mouth water. No, you can't do that, right? You cannot overcome your body's autonomic nervous system. And so it's not all in people's heads. So now to get into really what the data is. So this has been looked at in both what you would call subacute stress and chronic stress. And so for subacute stress, they looked at college students and looked at skin barrier function, how well your skin protects you from the environment, which we know is the fundamental problem in eczema. How was your skin protect you from eczema? They looked at that kind of right whenever they got back from from a break. So they were very, college students, unstressed or relaxed, how their skin barrier function was. Then they looked at skin barrier function during finals week. So subacute stress, dramatic changes in skin barrier function, reduced lipid production, probably related to steroids, to the cortisol that your body makes naturally. And then they also looked at chronic stress by looking through people going through contentious divorces. And again, showed that stress dramatically affects, skin barrier function and skin physiology. Now, also, I'm a firm believer, so we know for sure, for example, that sweat makes atopic dermatitis worse, and autonomic nervous function causes increased sweating. And so, we know it's more than just the physiologic effects on the skin. So the problem becomes, okay, if you're somebody who has atopic dermatitis, you already know, well, if I get stressed, it makes me worse. Okay, great, right? So can I help? Is there something we can do? Probably the only things that I would suggest, and there are no data to really back this up, but the both non-pharmacologic and pharmacologic approaches should be helpful. So there is some data showing that hypnosis can be helpful in atopic dermatitis. If hypnosis is helpful, then we also know that probably we should know that meditation would be helpful. I would imagine that pharmacologic approaches, so things like antidepressants and SSRIs, may be helpful, although I haven't seen any real data about that. The one thing that we do have good, solid, pretty rock solid data on is melatonin. And so we know that stress affects circadian rhythms, can affect sleep. And when they've looked at melatonin as a sleep aid as a replacement for, Benadryl or hydroxyzine, they actually found that sleep improved and atopic dermatitis improved. And so, getting good sleep seems to be an important thing as well. But right, if you're itchy, it's pretty darn hard to sleep. So, but those would be, I don't have a great answer for like, so if something stressful is going on, do this. But we definitely know for sure that stress makes atopic dermatitis worse via direct effects on barrier function, probably has direct effects on immune function as well. I mean, not even probably, we know stress affects your immune function, but may push in a Th2 direction and then through activating your autonomic nervous system as well.
So I think that's the hard part, for our patients, in today's day and age, everyone is so stressed. And I think it's something we have to really focus in because it's only going to help us in some way, shape, or form, even if, like you said, the data isn't there as strong as directly related to atopic derm, but patients report it. We know it anecdotally. And I think too, they're looking for ways to cope with this stress. So a little meditation and mindfulness, I think is a good thing to recommend just for overall health. But we've got more evidence. What I wanted to talk with you a little bit more about is essentially looking at just other ways to deal with atopic dermatitis. So we talked about the stress component, maybe ways to combat it, the role of melatonin. People want alternate solutions to manage their skin. What are some of the complementary alternate therapies that you like to recommend to patients? And what's the evidence that says it really makes a difference?
So fantastic question. And let me tell you, I am a really strong believer in the effectiveness of what we would call non-traditional therapies. But the challenge becomes there are so many non-traditional therapies available. How do determine what are you going to recommend? And then it's not just, okay, if it works, but it costs, an exorbitant amount, $400 a month in supplements or something, or some really expensive blood testing or stool testing. It's not, unless we know for sure that it's really, really going to be helpful, it's hard for me to recommend that. So I stick to things that, number one, we have really good evidence for, and number two, that are cheap. And so we actually have several of those things. So first, I mentioned melatonin. We've got randomized double-blind placebo-controlled trials showing that melatonin helps. I don't recommend it very frequently, but it does help. And that's because I'm typically taking care of people with severe eczema who really need aggressive pharmacological therapy, and that's going to get them so much better that they don't need something like melatonin. But for somebody with mild to moderate atopic dermatitis, I think melatonin can make a big difference. I recommend 5 milligrams QH at night. If it's a kid, I recommend 1 or 3 milligrams at night. And again, we have randomized double-blind placebo-controlled trials to support that. Other things that I recommend the next two things I recommend to everybody. So the first is an oral ceramide supplement. So ceramides are the special key component of your skin barrier that helps seal water in and keep irritants out. Things that might trigger eczema. And believe it or not, we have much better data that taking them by mouth helps your skin barrier function. Much better data for that than we do for putting them on topically. And so we have multiple randomized double-blind placebo-controlled trials showing that taking ceramides by mouth improves barrier function. The one in particular that I recommend is from a company called Life Extension. You get it on Amazon. It's about 16, 17 bucks a month. It's from a company called Life Extension. I have no connection with them. I don't make anything from this, but it is called Life Extension Skin Restoring Ceramides. It's one small pill a day. And I tell people, give it about 3 months to see if it's going to make a big difference. And the way that I describe how that's working, I tell people your skin is supposed to look like this and nothing can get in or out. Well, if you've got atopic derm, either genetically or from long-term damage from environmental chemicals, your skin looks like this. and has these gaps in it that are letting things in to irritate you and letting water out so your skin gets dry. So the ceramide acts as it fills these gaps in, and people get that idea. So ceramides, then the next one after that that I recommend everybody is a probiotic. And we have multiple studies showing that particular probiotics definitely help, whereas other probiotics definitely do not help. So there are certain strains that we need to get. There are 4 in particular. I can never remember the names of the 4, but the probiotic that I recommend is called Now, NOW. Again, you get it on Amazon. This one's about $8 a month. Now, NOW is the brand. Probiotic 10, meaning it has 10 strains of bacteria in it. And then they make different strengths. I recommend the 25 billion. It's the most cost effective. Costs about $8 a month. People and what that one is doing, we know that a big reason for the atopic dermatitis epidemic over the last 50 years has been the American diet. And in particular, the American diet upsets the natural healthy microbiome. And a natural healthy microbiome is supposed to be making substances that help calm your immune system and keep it regulated. And so we need to replace those natural healthy bacteria with this probiotic. And really, where you go with this one is if the patient says that diet, I have to avoid certain things or I flare, what should I be avoiding? What should I not be avoiding? It's not, there's nothing they're going to be able to figure out long term that is avoid this. What really is happening, there are certain foods that are going to cause relatively acute changes in the microbiome, and that then makes people flare. And so in which foods it is going to change over time. So instead of telling people to go see an allergist or avoid certain foods or try an elimination diet, you put them on a probiotic. And that is helping to calm down and regulate their immune system. And again, now probiotic 10, 25 billion. And then the third supplement, or the fourth, so right, we got melatonin, ceramides, probiotic. Then the fourth one that we have randomized double-blind placebo-controlled trials for is high omega-3 fish oil. And there again, we know the American diet, you have way too much omega-6, which is pro-inflammatory, and not enough omega-3, which is anti-inflammatory. And so we have randomized double-blind placebo-controlled trials. It's at least 500 milligrams a day of omega-3. And really, again, I recommend from Life Extension, they make a super omega-3. That's what I take personally. I take actually all of these things personally, even though I don't take the ceramides, but I take the probiotic and the fish oil. So the Life Extension super omega-3. And again, we've got randomized double-blind placebo-controlled trials supporting that. Now, I don't recommend the fish oil to everybody, and that is because the fish oil, the ceramide is 1 small capsule a day. The probiotic is one small capsule a day. And if you can't take a capsule, you can open it and pour it on food. But the fish oil is 4 big pills a day. So it can end up becoming a lot for the fish oil in terms of how much you have to take. But those are the supplements that I recommend. I don't recommend any topicals. So, some people talk about evening primrose oil, sunflower seed oil, things like that. Never seen any real data that anything topically really makes a difference. But those are the oral supplements that I recommend for people with atopic derm. So and again, the fish oil is an anti-inflammatory. The probiotic is to regulate the immune system, and the ceramides are to help restore barrier function. And all things together, I would say that those supplements get people 10 to 20% better. Now, it's actually more what I would say is it reduces the severity of eczema by 1 to 2 steps. So if we put eczema on a 10-point scale, 0, you're perfect, 10 is the worst you could possibly imagine being. If you're an 8, I think it takes you to a 6 or a 7. So it's not like, if you've got bad eczema, you can get better with the supplement. No. But if you're a 2 or a 3, and I can take you to, or if you're a 1, 2, or 3, and I can take you to a 0 or 1 by getting you 1 or 2 points better. I have a lot of patients who don't need to use any topicals as long as they are using the oral supplements. So they do make a difference. They all have randomized double-blind placebo-controlled trials. And those are the three that I know for sure have some benefit.
And if somebody wants to take those, as you mentioned, better part of a more complete treatment regimen, which we'll talk about another broadcast, but you mentioned, a little bit of a concern, which I think is important to bring up, the food connection. So when you have somebody come in, it's like, oh, this food is definitely making me break out. I need you to send me to an allergist. How do you handle that? Like, what do you tell patients like the real role potential food allergies and their atopic dermatitis? Because I think people think it's much more of a true cause than what it really is. So trying to dispel that myth and how we work with allergists, but really it's more of a complementary approach.
So I will talk about two different things here. So I do think that there's a role for allergists in treating some cases of atopic dermatitis with allergy shots. We have some data to back that up. But first, to talk about how do we talk about food allergy? So the first thing, we've got data that tells us that about 2 out of 3 patients with eczema, food is a triggering factor for them. So it's not, I don't talk to, because 10 years ago, even probably 3 to 5 years ago, I was still telling patients it's probably a coincidence. I know it seems like every time you eat that food, you get worse, but really it's just that eczema kind of gets better or worse on its own. It's probably coincidental. Patients hated that answer. And to be honest, I think that answer was wrong. So it was once I understood more about the microbiome, now I will proactively bring diet up because it seems so that from the patient perspective, if they bring diet up, and then I, give them the answer I'm about to give. They often take it as like I'm making something up just to placate them. Whereas if I bring it up proactively, then they feel like, oh, this guy knows what he's talking about, huh? He brought up food. Most doctors tell me food's not an issue. So I will proactively often bring up, hey, so about 2/3 of my patients with eczema tell me that food is a major trigger for them, but they usually can never pin it down to just 1 or 2 foods. Does it a trigger for you? And if they say no, then I'll still be like, well, it might become a trigger. So we're going to, and if they say yes, then it's much easier though. So if they say yes, then I say, okay. Now it's a really interesting thing because we know that food allergy never makes eczema worse. So now food is definitely causing your eczema to flare, but it's not a food allergy. Food allergies show up as stomach aches, abdominal pain, maybe hives. Like, if you ever know somebody who's allergic to peanuts, like if they eat a peanut, they die immediately. That's what food allergy is. Food allergy is never my eczema gets worse. So, but food is definitely making your eczema worse. It's not an allergy. It's that food is really processed in your stomach and in your intestines by the natural healthy bacteria that are supposed to be there. And we know that the American diet, things like food additives, food preservatives, emulsifiers, antibiotics, hormones, all of those things in food are upsetting that natural healthy bacteria. Then once that happens, certain foods and which foods it is will change over time because the bacteria are always changing, will make that worse and make those bacteria even more unhappy. And then so that can make your eczema worse. And so the key isn't to figure out which foods to avoid because it's changing all the time. You will notice, boy, sometimes, for a few months, anytime I eat tomatoes, I get worse. And then suddenly you can eat tomatoes just fine, but now anytime you eat corn, you get worse. It changes over time. So it's not about finding the foods to avoid. It's about getting that natural bacteria healthy again. And we're going to fix that by having to start to take this probiotic. Now that patients really appreciate that. Now to talk about the role of allergen immunotherapy. So particularly for dust mites. So we've got fairly good evidence that doing immunotherapy for dust mites for people who are highly allergic to dust mites does seem, or not even seem, we've got reasonably good data that it makes a difference. Now, the problem is that getting immunotherapy, if you're highly allergic to dust mites, can be a real problem because people will often get severe reactions from the shot, either locally or they could get a systemic reaction where their airway starts to close off. They're like in the allergy office, it's an emergency. But if you've really got somebody who's really stuck and nothing's working for their eczema, it can be very reasonable, especially for dust mite, to get tested. And then if you are allergic to dust mite, to get treated for dust mite allergy. But again, it is not easy treatment. And then even if you are able to get through the initial few shots, which is where you see most of those side effects, then you've got to be going into the allergy office like once a week, for a year essentially to get shots. And so it could be a real challenge, but in tough cases it can be helpful. But that's about the only place that I've really seen data or clinical experience that allergy shots really helped.
Well, that's great information. I think that clarifies, a little bit of where patients, want to jump the allergy train quickly, which we know a lot of people with eczema just happen to have seasonal allergies as well, or allergies to other things. But the relevance to that eczema, or their atopic dermatitis, is part of what the question is, and where we can work with allergy to figure that out if it's worthwhile. So we got some really good secrets and tips from you here today, and we're going to wrap up the podcast because next time we'll have you on to talk a little bit more about the pharmaceutical therapeutics that are available for patients. Which one works? Which one is better? Which one do you think is the right time for a patient to start on? So we'll dive into that a little bit deeper on our next episode. But I want to thank you, Dr. Zirwas, for all the information today. They're going to have people thinking twice when they stop in that supplement aisle or maybe look online that they have alternatives to help with their atopic dermatitis.
Yep. And the big thing with the supplements, I always tell people give it about 3 months. Get on all three of them. If you're gonna do it, at least the ceramides and the probiotics, and give those at least 3 months. And I'll even tell people give it 6, because we know they're good for you in general. It's really just a matter of, is it worth spending the $25 a month to be on them? And I think you can figure that out in 3 to 6 months.
Great tip. Great tip. And for those of our listeners that want to find you, where can they find you? Online, available, or everywhere?
I stay under the radar. They can find me on the Derm-It Trotter podcast. I do no social media or anything else of my own. And so I'm really not out there anywhere.
All right. Well, find him here on the Derm-It Trotter podcast, and maybe we'll be able to get him into one of our future parodies or TikTok or Instagram videos. We'll try. We'll introduce you.
I would love it. Love it.
Great.
Right. Thanks, Dr.
Thanks
Trotter.
again.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.